Welcome to everyone tonight. This is the first episode, I suppose, if you want to call it that, of It's a Brain Thing. Let me give a little background to you guys tonight, because I think there's some new faces out there, and because it's the first one of the school year, I thought I'd give, kind of introduce myself and explain a little bit about why I do these things, and also some kind of exciting stuff about how you can also catch these things on the internet and on TV. First of all, my name is Dr. David Henley. I'm a psychiatrist by training, which is a medical doctor that goes through medical school and all that, and then can prescribe medications and learns a lot about the brain, spends a lot of time seeing patients and learning about brain illnesses. And one of the reasons that I do these talks is as you guys know, there's a huge stigma in our society about the brain. A lot of folks, and what is stigma? Stigma comes from when people don't understand something. So in the old days, people didn't understand somebody acting a little differently. They thought they were possessed by the devil, or they had some other, something else going on. So when we don't understand something, we don't tend to treat those folks very well, or we stigmatize things. So my idea for this talk was there is a lot of knowledge out there about, the science is there for some of these illnesses of the brain, and somebody is probably somebody that knows something about it ought to get up and start spreading the word a little bit. So I had the idea of having these little talks in the community and kind of open to anyone that wants to come that has an interest, and I'm trying to reach as broad of an audience as possible. I do these usually the third Tuesday of every month through the school year. This one's a little off. My wife's 40th birthday was last Tuesday, so I would have been seriously in the doghouse if I'd have done a talk on that night. So I pushed this one back, but from now on it'll be the third Tuesday of every month. Last year I started getting them on WCTV out of Wayne County, out of the Richmond. It's in IU East. I think it's through IU East. And they are showing those Monday, I think Monday evening starting at 8 o'clock, and it's every 4 hours till Tuesday at 4 p.m. And so they've been nice enough to show them. And that reaches, I think he told me about 20,000 households in Wayne County, which is, it's pretty good. And then I started thinking even outside the box further, and I thought, how about trying to get these on the internet? And I had a friend has anybody heard of YouTube? Some of the younger folks probably have. Nobody's ever heard of YouTube? There's a website, you got to check it out. It's entertaining, mildly entertaining. But you've heard of MySpace? Anybody heard of that? MySpace it's a blog site, I guess, where folks get on and they kind of talk about their lives or the world or whatever. They give their opinions on things, and it's just everyday folks like us. Well, YouTube is the video version of that. So folks set up a camera, film themselves talking about something. Sometimes they film kind of goofy things, that I wouldn't advocate doing in real life. But I had the idea, well, it's free to do that. Why not get these? Why not, I'm taping these anyway. Why not put them on there, and then I can reach people all over the world. Basically, if you have internet access, you can get this. You can get this information. And sure enough, and it's something I wanted to mention in this one. This will be posted on the internet after a few days here. I wanted to say hello to a guy in China. I got a nice message from a guy who admitted that he had panic disorder, and he watched the panic disorder video that I put out, and he said, I saw that you had mentioned you wanted to reach as broad an audience as possible, and I really got a lot out of your video and wanted to say thank you, and that you had reached the People's Republic of China, so I thought that was pretty cool. The other thing is a guy from Australia suggested that I make these into podcasts, which are, I don't know if the younger folks know what those are, but basically if you have an iPod or an MP3 player, I can convert these from a video file into an audio file, and then you can download them and listen to them, on your way to work or whatever else. Because I kind of cover a lot of information in here, and it's kind of hard. You don't want to take notes. None of us want to do that. We're out of school now. We don't. That's no fun. So you don't need to take too many notes. If you want, you're welcome to, but you can always catch it later on the internet. So anyway, that's sort of the exciting stuff. I have the website for the YouTube thing on the back, and I'll show you that towards the end a little bit. I have covered, I think tonight is the last major type of psychiatric or brain illness that I had wanted to cover that I hadn't yet. And what we're going to start doing is, I didn't get all of them on tape. So there's one on substance abuse, which I need to redo because I didn't get it taped. And I want to get it on the internet and on the TV. So we're going to do that next month. And then I'll try to cover ADHD again if I can get my friend to come back and help me out with that, since I'm not much of a child psychiatrist, actually. Try to get her to come back and help me out with that one, and we'll do a couple of the other beginning ones that we did. And so those will be a little bit of repeats, although it's been a year or so or more since I did those. So that's kind of the scenario for the year. Tonight we were going to talk about, I wanted to talk about psychosis and psychotic disorders. Folks probably, I mean, what do you think of when you hear psychosis? Does that, what do folks think of? Have you guys heard of somebody being psychotic? And if somebody says, oh man, they're psychotic, what is that? Do you think crazy, or what do you think? A lot of folks think crazy. I kind of hate that word. I don't really like the word crazy, because the heck is crazy? It just means they're acting different than someone else. And it's also a little bit, it's kind of mean, you know, like what does it mean? It puts somebody down a little bit. So I always prefer to call things what they are, and after tonight you guys will be able to say that person has psychosis, because you'll know what that is. Psychosis, in a nutshell, is basically where somebody is not thinking in reality. Look at me, I'm getting brave. I thought I was going to do this without my notes. It's basically where a person has, you know, they may see something, they might hear something that other people can't hear. They may have a thought that something's happening, like a paranoid thought. Somebody's out to get me, somebody's going to hurt my family or myself. So their thoughts are not based in reality. When you say, you know, and that's always a little bit subjective, right? So when I say not based in reality, what I mean is there's no evidence that these things are occurring. But the person that's having these thoughts, or seeing these things, or hearing these things, they think absolutely it's happening. Without a doubt it's happening. I mean, they believe it. So when you talk to the person about it and you try to challenge them and show them evidence that it's not occurring, they don't like that so much. They don't have any insight, that they can't see that point of view at all. There are other things that occur sometimes with psychotic disorders, especially, and sometimes with psychosis, and that's the person's speech can be unusual, can be incoherent or unusual in some way, and then their behavior can be really agitated or really sort of disorganized. They do a lot of things without much purpose. Now, why do we care about psychosis? I always ask that. You know, why do we care about these illnesses that I'm talking about? Obviously, it kind of interferes with function, right? I mean, you're not going to be able to, if all you can think about is somebody who's out to get you, and you're up all night, and you're looking around at the cars driving by, and you're thinking those folks are spying on me, and I just know it's just a matter of time till he comes and hurts me in some way, or my family. You're not sleeping well. You're not going to be able to focus on work for sure, school, relationships. So it definitely interferes with your day-to-day life and your day-to-day function. And you know, when it gets severe, the person, you know, either they end up in the hospital if there's somebody that cares about them enough to get them to the hospital, or unfortunately, some of these folks will end up homeless. And you know, I know you guys have probably been into like downtown Indianapolis or Chicago or someplace, and you'll see folks that are, you know, that are homeless, and they're talking to someone who's not there. You know, those are probably folks with schizophrenia or some other type of psychotic illness. They're obviously talking to something that's not there, but to them, they hear it. And you know, unfortunately, those are folks that you know, that nobody's picking up and forcing into treatment, and they won't get treatment on their own because they don't think there's anything wrong. And we'll go into that in a minute as to why they don't think there's anything wrong. What are the symptoms of psychosis? Anybody heard of a hallucination? That's kind of a big, that's sort of one of the most common types or symptoms of psychosis. A hallucination is where, and it can be any kind of hallucination, okay? So it can be something that you see, something that you hear, that you taste, that you feel, you know, any of these things, even smell. So hallucinations are where you see or taste or whatever something that nobody else can see or hear. Okay, so hang on to that thought about hallucinations. Then they sort of divide the hallucination into whatever, you know, what symptom it is. So if it's auditory, what is that, guys? You know, something you hear, right? So an auditory hallucination is something. It can be a sound. It can be it can actually be a formed voice. It could be a voice as clear as you're hearing my voice now, except that there's no one around. Okay, and when folks have auditory hallucinations, those can be familiar to the person. They could be like the sort of, you know, family member or somebody who's abused them in the past or something like that. They can also be unfamiliar. They can be childlike, you know, children's voices. They can be adults. They take all different forms and have all different manners, I suppose, about them. Sometimes they're very aggressive and they're very hostile to the person. Sometimes they command the person to do something that they don't really want to do or they would rather not do. And to give you an example, let's say somebody has schizophrenia and one of their paranoid thoughts is that that somebody is the Antichrist, which is, you know, it's not uncommon for folks with schizophrenia to have thoughts like this. So they think mom is the Antichrist, okay? And the voice starts to tell them, you've got to kill Mom to save the world. If you don't kill Mom, the world's going to end because she's the Antichrist, you know. And of course, this illness affects your ability to sort of rationalize and think through that, right? You start having trouble telling, you're obviously having trouble telling what's real and what isn't. Maybe you truly believe she's the Antichrist, and then these voices just kind of wear on you day after day. You got to kill her, you got to kill her. And you guys have heard about this kind of thing in the literature, in the press, folks that actually do. Then they kill their mother, or they kill somebody that's close to them. And you've probably all heard about, well, they were found not guilty by reason of insanity or something. And a lot of us probably say, oh, yeah, right, whatever. Now, there are cases like this, true cases like this, where these folks do have psychosis, and they really had no idea what they were doing was wrong. Most of us have a hard time fathoming that. How could you not know that killing your mom is wrong? But in their reality, in their world, they thought that was the right thing to do. So these command hallucinations are kind of scary, a little bit dangerous. So, you know, as a psychiatrist, I would always ask patients, you know, what do the voices tell you? What do they say to you? To try to make sure that they weren't, you know, focusing on some particular person that we needed to warn or get out of harm's way. Another thing they can do, and just think about this for a minute, they can carry on a commentary about you. So you're walking along, you're going on your day-to-day life, you know, and all of a sudden you get this voice, hey Dave, you're an idiot, you know, or hey Dave, you know, you can't do anything right, and constantly putting you down. So everything you do, it's carrying on this commentary and, you know, putting you down and just, you know, tormenting you basically. Now they're not always negative. I should say that I've seen a patient before that had a positive commentary, like good job Dave, you know, you're doing a good job, but that's not as common, unfortunately. Or if it is as common, it doesn't come to treatment as much. I suppose that wouldn't interfere with your function as bad as somebody that is a voice that was telling you were, you know, negative things, I guess. You know, another type of hallucination is a visual hallucination. Any idea what that is? It's where you see something, right, that other people can't see, okay? I once had a gentleman who was in a nursing home and had a certain type of dementia where he looked out the window and he would see cows grazing in the field. Now, I would look out, I couldn't see the cows. His wife would look out, she couldn't see. The nurses were looking out. Nobody could see the cows, but he could see the cows. And it was very upsetting to him that none of the rest of us could see it. And so we kind of had to make a pact that we wouldn't tell him that we couldn't see him. You know, we would just say, oh, that's nice, or something, you know, which I think a lot of people have a hard time with. But if we didn't do that, he'd get very agitated and, you know, upset and wouldn't eat and things like that. And of course, we didn't want that. So visual hallucinations, again, they can be very formed, or they can be shadows, or something that's not very formed. The shadow thing, it tends to come in a lot of times with some folks will have like eye diseases of the back of the eye, the retina, and these folks, as their vision starts to drop back, the brain, the part of the brain in the back of the brain here that is responsible for kind of interpreting what you see in your environment, you know, it's not getting a message anymore, and so it starts to come up with things on its own. It starts to hallucinate. So those can be kind of shadows and things like that that folks will see. Tactile hallucinations. Folks that drink alcohol and then start withdrawing from alcohol will sometimes feel this feeling that there's bugs crawling all over their skin. Okay, those are tactile hallucinations. It's a feeling that something's happening that isn't probably happening, like the bugs. There's no bugs, but it feels like it. I once had a gentleman who had an olfactory hallucination. That's where he would smell something burning. And I tell you, I got a good nose, man. Look at the size of that thing. That's a good nose. I couldn't smell it. None of the people in the office could smell it. His family couldn't smell it, but he could smell something burning. And it was interesting because he had bipolar disorder, and it would be mainly when he was starting to slip into starting to get manic or starting to get depressed, he would start to smell this stuff. Otherwise, when he was doing pretty well in his mood, he didn't have so much trouble. I can't say that I've ever seen anybody with a gustatory hallucination. That's where you taste something that we don't think is real. Now the problem with that one is, you know, if you taste it, I can't tell if you're really tasting something or not. So that's a little bit difficult. You can have, you know, just because you have something like this, a hallucination like this, doesn't mean you have a full-blown psychotic disorder like schizophrenia or something. There are times, like I just talked about with the eye disease, and where folks will start to hallucinate, but it's not because they have schizophrenia or anything. It's because of the eye disease. Another common example of this is there are types of hallucinations that folks will have when you're just drifting off to sleep. I don't know if anybody's ever experienced that or not. It's common in people with obstructive sleep apnea. Have you heard of that? It's like where folks start to go to sleep and their airway shuts down on them. These folks, when they start to go to sleep, and sometimes when they start to wake up, they come out of a deep sleep and start to wake up. Actually, they're not in deep sleep much if they have obstructive sleep apnea, but you know what I mean. They're starting to become more awake. They'll hallucinate sometimes. They'll see something or they'll hear something. And the fancy word for that is a hypnagogic hallucination. That's when you're going to sleep, and a hypnopompic hallucination when you're waking up. Those are not, doesn't mean you have schizophrenia. That's probably from like the sleep apnea or from some other, it can be just a normal thing in some people. So the other symptom of psychosis that we should talk about is a delusion. I sort of alluded to this a second ago, but a delusion is where you feel something is happening or you think something's happening when it isn't. And I can give you some examples of this. These can be sort of bizarre thoughts. Folks with schizophrenia, they tend to have more bizarre delusions. So it's like an example would be somebody who feels like the FBI is out to get them in some way, and that maybe the FBI has put a bug in their brain, a transmitter in their brain that transmits their thoughts to everyone else, and to the so that the FBI can then read it. That's a little bit odd, right? And any of us, if we heard that story, we would say that's probably a delusion, right? None of us would think, boy, that probably could be true. I think that's real. That's pretty easy, For a psychiatrist, that makes my job easy. I can, that's pretty common, pretty easy for me to figure out. On the other hand, some delusions are very believable, and I'll give you some examples of these in a minute. But like, for instance, somebody's out to get me in some way. Well, usually these stories come with kind of an elaborate story as to why this person's out to get them and all this, and it's really kind of hard sometimes to sort out the reality from the non-reality. I gave you an example of a delusion, the FBI thing. That's a common one for somebody with schizophrenia. But what about somebody who gets manic? Well, when you get manic, if you remember from the talk, I don't know if anybody was here then, but manic folks they feel very empowered. Very grandiose is a fancy word for it, but they feel like they have special powers. They can solve the world's problems and things like that. Well, if they get psychotic and start to get delusional, a lot of times they'll think they're Jesus Christ. Obviously, we don't think that they really are Jesus Christ. I mean, I don't know how to know that for sure. But, the thought is that they have this special power, some special ability. And sometimes one person I remember thought he was the president of the United States. So these delusions can be grandiose, they can be odd, they can be very believable. But basically, the common theme is that it's something that's not really happening, but they think it really is happening. Incidentally, I once had a situation where I was working on a psychiatric unit, and there were two guys that were manic on the unit, both of whom thought they were Jesus Christ. Now, that was not such a great situation. It's a little war of the worlds there or something. But some interesting things. Being a psychiatrist, you get to see some pretty neat stuff. On the one hand, it's sad because these are illnesses, and all, but they're treatable, and once the person gets a little better, they're able to laugh at it sometimes and realize, geez, I can't believe I thought that. I will say, having said that, that it's more common for a person. Remember, I mentioned that these folks, when you start to become psychotic, especially with diseases like schizophrenia, and delusional disorder, which we'll get into in a minute. I told you these folks don't really realize they have that what they're thinking is not real. I mean, to them, it's very real. Okay. And so when you treat the psychosis, it's kind of uncommon for it to go completely away, especially the delusions. Sometimes the hallucinations will go completely away, and sometimes they won't, but they'll just be kind of minor, and they won't be right on the person's mind all the time. The person will be able to focus on their job a little better, be able to talk to you about something else once in a while instead of just the hallucinations. And the same thing with the delusions. If you ask the person, is so-and-so still out to get you? They'll say, yeah, I think, but they're not following me as bad. I don't see the cars driving by as much as I used to, or things like that. That's how the treatment goes. But it's not typical for the treatment, for the person to get treatment, and then all of a sudden they have no thoughts now at all about the paranoia, and they don't have any voices at all. That's a little bit unusual. It's great if that happens. That's great, but it's difficult to get the person to that into doing that well sometimes. But what causes psychosis? There's a lot of things. It's not just schizophrenia. I keep talking about schizophrenia and bipolar disorder and things. It's not just those things. It also can be things like dementia. Different forms of dementia can do it. Delirium. Drugs like LSD, other hallucinogens, methamphetamine, cocaine. Mood disorders. You can have just plain depression, major depression with psychosis. You can have bipolar disorder and get manic or depressed and have psychosis. There's a whole bunch of things, and I'll go into some of the others here in a moment to give you an idea. The other question you might ask yourself is who, and I don't want to scare you with this stuff, but who can be psychotic? Do you think any of you guys could get psychotic? If you have a brain, which I think most of you probably do, you guys could all become psychotic. Remember we talked, I don't know if some of you weren't here then probably, but we talked about how anyone can become depressed. It's just a matter of how easy it is for you to get depressed is the issue. Some people it's not easy at all. It takes a ton of stress to become depressed, okay? Other people, it's day-to-day life and they become depressed. And that has to do probably with your wiring and your upbringing and everything else. The same thing is kind of the case with psychosis, right? So based a little bit on your wiring and based on your environment, it's either really easy to get psychotic, and that would be somebody like schizophrenia, like somebody with schizophrenia. With schizophrenia, these folks, just day-to-day stressors are enough to make them psychotic. So they really have to take treatment, have to get treatment, or they're psychotic. And and that's tough. That's a very tough illness. We'll talk about it in a minute. But any of us could become psychotic. It's just a matter. It's different for each of us as to how much it would take. Let's give an example, sort of the opposite extreme. So you have a schizophrenia person who's wired in a way that just a little bit of stress and they become psychotic. What about the other extreme? You hear about sometimes folks that have no history of psychosis at all, but now they've become a prisoner of war and they're stuck in a pit somewhere where they don't get any sensory input. So they can't see anything, it's dark in there. They can't hear anything, and that goes on for days to weeks, right? Their brain, they will start to become psychotic. They will start to see things and hear things because their brain, the way I think of it is, the brain has nothing to do, and it starts to exercise itself, so to speak. I mean, that's very simplistic and may not even be the case, but that's the way I think about it. So the gist of it is anybody can become psychotic. Well, think about LSD as another one. A lot of people when they use LSD are going to become psychotic. It's just that's what that does in your brain. And all of this, again, all of this comes down to the brain. All of this stuff is caused by certain pathways in the brain that either are abnormal to start with or are made abnormal by LSD or by stress or something else. So, not to scare you all, but any of us could become psychotic. So just something to keep in mind. So I guess the key there is what you should realize. And the reason I give these talks, is that we all have brains. So you should never look at somebody and say, "Oh, look at that wacko. He's talking to no one," and things like that. Or look at that crazy guy. You don't just be careful saying that stuff because that could be you in 3 days. Okay. I get kind of passionate about that stuff. But that's part of the reason I do these talks, I guess, is so folks realize that stuff. Now let's go into schizophrenia for a second. Have you guys heard of schizophrenia? I'm sure most of you have heard of it, right? Most of the time, it seems like people always think that's like a split personality or a multiple personality. You've heard that before, Pat. And folks say that a lot, I guess. It's really not, and I'm not sure do you know where that comes from? I'm not sure the history of that. But I mean, it's not that case. It's not the case. It's not multiple personalities or anything like that. What we think it is, what it is symptom-wise, is that for at least 6 months, a person has symptoms of psychosis. Usually it kicks in the late teens to early 20s. It can be a little later for women than men. But these folks usually have some type of stressor, and then they start becoming psychotic. And that's what these hallucinations and delusions that I just talked about. They'll start to think that the FBI is out to get them. There's a transmitter in their head. I say that when I use that example again because it's kind of common. But it can be different things. In addition to that, and depending on there's different types of schizophrenia, but depending on the type, they can also be very disorganized in their behavior. They can't really focus very well on stuff. They have a hard time, thinking about what I need, going to the grocery and figuring out, okay, I need this for Monday for meals and this for Tuesday for meals and so on. They can't do that very well, so they don't eat very well, don't take care of themselves very well, don't remember to shower. And so, as you can tell, it really interferes with function. And remember, with psychiatric illnesses, most every psychiatric illness, for us to say that it's a disorder, it has to interfere with your function, right? I mean, if it's not interfering with your function, maybe it's still a disorder, but it isn't. It's not something that we're going to call a disorder because you're able to function okay with it. Now, in this case, as you can imagine, this really interferes with day-to-day function. You have to rule out any other psychotic disorder for you to be able to say it's schizophrenia. So if a person just took LSD, and this is the hardest part, because you get these young folks that come in and they're 18, 19 years old, they're experimenting with drugs like a lot of kids do, and next thing you know they're psychotic. And now you got to scratch your head, okay, now they used LSD, now is this going to clear up, or are they going to continue to have this? And if they continue to have it, that's where the 6-month thing comes in. You don't want to just say they have schizophrenia after 3 days because it could be the LSD, right? So you wait and you kind of follow them over time, and if after 6 months they haven't cleared up and they're still not, they haven't used for that much time, that's when you start wondering, gosh, is this something like schizophrenia or some other psychotic illness? But you have to rule out other things too, other psychotic disorders that we're going to talk about in a minute. Now, there's different types of schizophrenia. There's paranoid type, which sort of sounds like what it is. I mean, these folks have a lot of the hallucinations and delusions, paranoia especially. But they don't seem to be as bad as far as being disorganized in their speech and their behavior. Then there's the disorganized type, which is sort of the opposite. These folks aren't quite as paranoid, they don't hallucinate quite as much, but they are very disorganized and very. These are interesting folks because you'll talk to them and they're making words. I mean, you can hear the words, but they don't make any sense, and you can't follow them very well. So that's the disorganized type. Catatonic type. You ever heard of catatonia? Anybody heard of that? That's a fascinating thing. We don't know what really causes that, but it's almost like the person checks out. They're on a different plane of existence or something. They don't talk very much. If they do talk, they just sort of repeat what you say after you. Sometimes they repeat your behaviors, the movements and things that you make. Sometimes they become very, we call it waxy flexibility. So imagine if your body was made out of wax, okay, and we take the person and we put their arm up like this. They'll hold that position for hours. Stay just like that. It's sort of like a Gumby doll or something, where you kind of form them into a shape, and they'll stay that way. It's really kind of fascinating. They posture, which is sort of like that, but not to that bad a degree. It's like they do that on their own. They grimace a lot of times. They have some stereotyped movements where they just, over and over again, they do the same thing over and over again. And that's called the catatonic type of schizophrenia. And then there's some other, residual and differential. I won't go into all that. Interesting thing about this, by the way, it's not something, you might think, well, is it just in America this happens? It's not. It's 1% of the population anywhere in the world. North, south, hot, cold, doesn't matter. Doesn't matter your race, it's 1%. So it's kind of an interesting thing to think about. In my head, I always think about, now, why do these illnesses still exist? I mean, I can't imagine through the years, I don't know why somebody with schizophrenia would have survived back in the days where, we were running around hunting for lions or whatever, or beasts to kill and eat, Somebody with schizophrenia, I don't think it would help you much. And, a lot of these things, we talk about, like we talked about with panic disorder, for instance, that's a normal part of your brain that just is kind of going haywire, okay? And sometimes you might think, well, somebody who's extremely anxious, maybe that was a good thing, because maybe they survived when the other folks weren't as attuned to their environment and they got eaten by lions, right? But the anxious person, they were really attuned to their environment and they were looking around all over the place and they survived. I don't know why. Schizophrenia must have some. It wouldn't exist at 1% of the population over the years like this for no reason. So there's some reason it has continued to exist, and I'm not sure what it is. But just so you know, it's 1%. It's not different depending on where you go. We think it's a neurodevelopmental thing. What does that mean? Well, you guys know how, like, when you're a baby, all of your body, everything starts out really in these little few cells, and then it kind of develops and grows. The brain does the same thing. It starts out as a few cells, and then it starts to grow. And these nerve cells, as they develop, as they get bigger and bigger, they kind of sprout, sort of like plants, I guess, in your garden. They sprout and they grow. They kind of know, this is interesting, but they kind of are programmed to go to a certain spot and stop and become a nerve cell to run my left arm or something, okay, or a bunch of nerve cells to run my left arm. We think that some of these, what we found is that there's too much in some folks with schizophrenia. There's too many nerve cells in a deeper part of the brain, and not enough out here in the frontal part of the brain. So we think that something is happening. Either they're not developing like they should, out to where they should, they're stopping short, or the brain is sometimes, during adolescence and during these late teen years, there is a lot of pruning, sort of trimming the hedges kind of, that your brain does, and that's normal. And maybe that process is going awry somehow. Maybe Edward Scissorhands is getting kind of crazy and he's kind of cutting down to the quick, and there's the nerve cells are getting kind of hacked back when they shouldn't be. Because that might explain too why it's kicking in at that age, at that young age. In essence, though, I mean, we don't know what we have those theories.